Good afternoon, everyone. We're just going to give a moment for people to get logged in here. Hello, hello for everyone jumping in. I'm just going to give us about one more minute and then we're going to get started. I would like to thank everyone who's here so far for joining us for this conversation on taking action to support under-resourced communities. We're really excited to have a really great panel today and we're going to have a really cool discussion. Hi, Belinda. Thanks for joining us. All right, we're going to go ahead and get started and jump in. Again, I would like to welcome you all on the behalf of the National Center for Civil and Human Rights and myself, our donors, our CEO, our partners. Thank you for joining us during our campaign for equal dignity. Today, we're going to have a discussion on taking action to support under-resourced communities. We have some really great people here with us that have joined our panel. I'm going to introduce them here in a second as we get started, but first I'll introduce myself. My name is Jasmine Page. I am the Education Programs Coordinator here at the National Center for Civil and Human Rights. I do a lot of work to facilitate lesson plans within schools and outside of schools and use various immersive opportunities to expand learning around equitable history, also around empathy building and human rights. I've been doing this work for a few years now. I was previously working at a few other museums, and I like to focus on educating outside of the classroom. I have a bachelor's in theater education from Old Dominion University, and I have a master's in creative and innovative education from Georgia State University. So I'm really excited to moderate this discussion for you today. First up, I would like to introduce Greg Cole. Greg Cole is the executive director of the Emmaus House. Hey, Greg. Greg has worked at Emmaus House in social work, social service and education. Sorry. Just moving my things. Mission of the Episcopal Diocese of Atlanta for 7 years. Prior to that, he worked at Habitat for Humanity affiliate in Florida. Greg has a Master's of Divinity degree from Harvard University. He is the president of Greater Atlanta chapter of the Associations of Fundraising Professionals and sits on the advisory councils of the Islamic Speakers Bureau and the Atlanta Speech School. Thank you so much for being here with us today, Greg.
Thanks for having me.
Next up, I would like to introduce Terrence Lester. He is the founder of Love Beyond Walls. Terrence Lester is a speaker, activist, author, and thought leader in the realm of systemic poverty. He's known for nationwide campaigns that bring awareness to issues surrounding homelessness, poverty, and economic inequality. In 2013, Terence founded the nonprofit Love Beyond Walls and has played has helped hundreds of individuals experiencing homelessness and poverty rebuild their lives. In 2019, Terence launched the first museum in the US that represents homelessness out of a shipping container, and it's called the Dignity Museum. Terence has written 4 books, and his new book, I See You, How Love Opens Our Eyes to Invisible People, released August 13th, 2019 with the InterVarsity Press. He also holds 4 degrees and is working towards his PhD at Union Institute and University in Public Policy and Social Change. Thank you so much for being with us today, Terrence.
Yeah, thank you for having me. Great to be here.
Awesome. Finally, last but certainly not least, I would like to introduce Anterior Leverett. She's the Volunteer Services Manager at the Society of St. Vincent de Paul. Anterior Leverett joined the Society of St. Vincent de Paul team in March of 2020 to serve as the Volunteer Services Manager. As a Kennesaw State University graduate, Anterior previously served as the Public Programs Coordinator and Youth Volunteer Manager with the Atlanta History Center. As a member of Kennesaw State University Center for Student Leadership, she and her peers work closely with students at the University of Southern California to evaluate the homeless populations in Atlanta and Los Angeles. This allowed for both universities to work with organizations and address issues of homelessness in their communities. As the Volunteer Services Manager with St. Vincent's de Paul, Anterior has been fortunate to work closely with SVDP's team and caseworkers and food pantry managers to feed families in the Metro Atlanta area. She's excited to be a part of today's panel to speak further about the work being done with St. Vincent de Paul, Georgia. Thank you so much, Anterior, for being with us.
Thank you so much for having me, Jasmine.
Of course. So we're going to jump right in. We're going to ask our panelists a few questions. We're going to give some time for our participants to ask questions at the end as well. So feel free to keep posting in the chats and the Q&As, and we will make sure that we get your questions answered as we get through. First, if we can get started on, if we can just go around, and Greg, we can start with you. If you can give us a little bit more of a description on what your organization does and what work that you've done in order to help and aid under-resourced communities in the Metro Atlanta area, and also nationally, if so.
Sure, thanks, Jasmine. So Emmaus House is as you said earlier, is a mission of the Episcopal Diocese of Atlanta. And we were founded in 1967. We're located in Peoplestown, still in the same buildings that we moved into in 1967. So we're a place-based organization that focuses on social services and education. And so on our social service side, we do a lot of benefits assistance, helping people with rent and utilities. We have a food pantry. We have a case manager who works with people who are looking to go through workforce training programs. And then our education side, we have an after-school program for middle and high school kids, and a Saturday program for elementary kids, and a summer program, which is a little changed this year, but a summer program that focused on literacy for elementary age children.
Awesome, thank you so much. Terrence?
Yeah, sure. So my name is Terrence. As Jasmine mentioned earlier, I work with Love Beyond Walls. One of the things that we've been working on over the last 6 years is reunification of people experiencing homelessness with family members. One of the great disadvantages of being houseless is not having social capital. And so our organization has been on the front lines providing community shelter, grooming and support services, also helping individuals recover their identification. But a huge part of it is the process of reuniting people back with their families that they have lost touch with. So we've been in this work for a little over 6.5 years now. And in that process, we've also placed a lot of people on jobs and helped some individuals to acquire housing. And it's a work that is, something that is oftentimes forgotten, but I'm grateful to be with my peers here today to talk about how we can walk with people out of these circumstances.
Thank you so much. And Anterior?
Of course. My name is Anterior Leverett, like Jasmine said previously, and I am with the Society of St. Vincent de Paul, Georgia. St. Vincent de Paul, our mission is to provide aid and help for those in a dignified manner, and that's what the St. Vincent, that's kind of the way in which he would help those in need. So that is what we try to follow. St. Vincent de Paul, Georgia, we have 72 conferences. And when I say conferences, what I mean is that we have 72 kind of groups of volunteers throughout Georgia, going as far south as Brunswick, Georgia. And what we do in the main council, which is our main office in Chamblee, is that we help to aid and assist those conferences. And the way that we do that is helping them monetarily, helping them with food. We have 21 food pantries. We have 12 thrift stores throughout the Atlanta metro area. And so we are making sure that we're, getting people fed, helping folks with clothing vouchers and things like that. If folks need furniture and furnishings for their homes, finding out ways to do that. One thing about our organization is that we are very frontward facing. And so a lot of face-to-face interaction, a lot of getting to know our clients. Our caseworkers will go into the homes, well, not right now because of COVID, but going into the homes and really getting to know our clients is really what we're all about. So we can best assess their needs and figure out what they need from there and using our resources to help folks. So that is what we're about. And we are doing this work throughout Georgia and continuing to help all of our conferences.
Thank you. As Anterior mentioned, we are still in the midst of a really big pandemic. I know for myself, it was a bit of a shock, left work one day and then was working from home the next week for months. So in terms of the work that you all are doing with the pandemic, there's been a lot of shifts and a lot of changes for people and for communities. How has that affected the work that you do? And how have you and your organization worked to adapt during this time? Anyone can.
Yeah, I'll go first. So we have a center in College Park, similarly to my colleagues here. We allow people to come here and embrace the community. We have a lot of, face-to-face interactions, and we kept hearing a lot of concerns from our community early on when things were starting to shut down and COVID-19 was beginning to rise. Like, I'm afraid that I'll contract COVID-19 because I don't have anywhere to wash my hands. I keep hearing from people that I'm supposed to wash my hands, but I don't have access to running water. And many people experiencing homelessness wouldn't be able to go to a library because, back then it was shut down, or a public space and it was shut down. And then there was already this social distancing that they've been experiencing long before COVID-19, where they couldn't frequent coffee shops or sit in public parks without being targeted in a criminal way. And so, our team started to sense that there would be a larger population of people that would need to have access to perform these hand washing procedures to protect themselves against the spread and the contraction of COVID-19. And so since we've been in the process of using RVs as temporary shelters in a way to help people have a safe space, there are many features on RVs that people use for leisure, like porta potties and portable hand washing stations. And I had the idea to take the portable hand washing station and start to place them all around the city of Atlanta in certain areas so people would have access to this feature. We started with about 15, and we set them in public parks. We partner with Woodruff Park. We partner with some businesses, a lot of churches that have programs that would feed people experiencing homelessness, and also some local shelters just to have that extra layer of protection. And since then, it kind of spread. Now we have hand washing stations in 22 cities. We just expanded to Canada, and we're projected to be in about 50 cities over the next month and a half. And what we've learned throughout this process in this pivot is that sanitation has been denied. The lack of access to sanitation has been denied, and it's a human right. When we think about the entire community or the whole community, that also includes people without an address. Just because you don't have an address does not mean that you're not a neighbor. And so our organization is positioning ourselves to continue to advocate for sanitation for all individuals who are without homes. And so that's one of the ways that we've pivoted. And we've seen, you know, these powerful stories where people would, you know, talk to us and say, I'm glad I got a chance to wash my hands before I eat. Something as basic as that we weren't thinking about, especially from a media perspective, and how would people be able to shelter in place when they don't have a place to shelter in, and how would people be able to have access to this important, you know, tool to protect themselves. And so that's how we pivoted.
Thank you. And that's amazing work. To be able to see that spread across not only cities, but countries and states is really amazing. Greg, Anterior, did you want to share?
Yeah, I'll go. Sure. Yeah, Terrence, that really is amazing and creative, and I commend you for that. It's a real inspiration. On our education side, we had to pivot because typically we do a 6-week literacy program for elementary age kids, most of whom go to the Barack and Michelle Obama Academy here in Peoplestown. And we do it actually in partnership with the school, at the school. We've done that the last several years. And it's a Children's Defense Fund Freedom School program. And we have typically 120 students. But it became clear that we were not going to be able to do that this summer for obvious reasons. We needed to think about what we could do because, you know, children that we serve have lots of obstacles as it is to literacy, and the scores, you know, the reading scores are not good. And so we're really committed to doing everything that we can. So we needed to move our program to be virtual. And we couldn't do it with 120 students, but we decided to do it with 40 students in second and third grade. And we hired several teachers from Obama Academy to work with us. So every day, each of those students spends 20 minutes one-on-one with a teacher doing reading exercises. And then on Fridays, they have kind of special events. And we also deliver physical books to each of those 40 students every week, along with a bag of groceries and art supplies. Wish we could do more, but, you know, like I said, third grade reading levels are such an important indicator of the direction of a student's life that we need to do everything we can to intervene. And the good thing is that we think maybe we've kind of figured out a model that we might be able to use kind of as a hybrid model during the school year, so that we can provide extra literacy instruction for kids. So we're excited about that. We're nervous about how children that we serve are going to re-enter school in whatever form that takes, and the long-term impact on their education. I think this is something that's really, really devastating.
Thank you so much, Greg. Thank you for sharing. And I think that's great work. It's so hard, especially when you think about accessibility in communities, to really try to figure out how to still give students the education they deserve without the resource of an actual school, how much we rely on an actual building. But we really appreciate the work you're doing. Anterior, would you like to share?
Yeah, I just want to piggyback off of that. Yeah, the work that you guys are doing is amazing. And I think a lot of times we don't think about accessibility and what that means for people. And so the work that you guys are doing, I think is fantastic. On our end at St. Vincent de Paul, we've had to change in a lot of capacities, but mainly the way in which we kind of operate in our food pantry, for instance. The way that we get our food is we work with 41 Kroger stores in the Metro Atlanta area, 4 Aldi's, and Sam's Club. And so when things first started, you know, getting food was really hard because these stores have been hit hard. People have been out shopping, doing the thing. So it was really hard in the beginning, trying to make sure we actually had food for our clients, because those numbers started to spike because people are out of work and are unemployed and underemployed. And so folks are unable to get food. So that was something in the beginning that we really had to pivot and figure out how we were going to keep our food pantry stocked, which we found a way to do that. And we've been able to work with farms to get fresh produce, which is something that we typically had and that we didn't have for a moment, but now we have again, continuing to get frozen meat so that people can actually have meat and things like that. in regards to our kind of front-facing model and being able to go into the homes and things like that, obviously we could not do that. That had to change. So we switched to doing things over the phone and still trying to have those conversations and really getting to know our clients and make sure we're giving them the best product that we can, but having to do it on a different scale. So that did have to change as well. And even in our food pantry, when people would come in, typically they're working with our pantry manager, they're working with our volunteers, they're getting food for their family. So we make sure that certain customs are respected and that we're making sure that that family gets the food that they need for their household. Unfortunately, this time around, we are taking in those orders and making sure that we're giving people the food that they need for their family, but they can't come into the space. So we've been fortunate to have some really amazing volunteers who've come through to help deliver food, and we've been able to give them the appropriate PPE to make sure they're safe, to make sure there's a protocol in place so that when they go knock on those doors and go drop off that food, that they're being protected as well along with the client. And recently, now that things are starting to open back up a little bit, still keeping in mind the CDC guidelines, we've kind of set up a drive-through model to go along with that delivery model so that for folks who are ready to get out of the house and who wanted to come pick up their food, they're given that opportunity. So those are some things that have had to change for sure. That food pantry model has been shifting and ever changing. There's been an ebb and flow, but we think we have a system now that really works to make sure that people can get fed. We've been working closely with communities near us, making sure that those communities are fed. And also as we continue to develop our workforce programming, as we're getting ready for that to open up in September, we're having to think about in the future what that looks like in case there is a second outbreak and what we should do to kind of make sure we keep our staff, our clients, and everybody safe in that space.
I just wanted to piggyback on that for both Terrence and Anterior. I think talking about the dignity of the people that we serve, right? And thinking when we had to pivot in our social service from allowing people into our building to maintaining that safe distance. You know, it's one thing to be able to sit down face to face with somebody across the table and have a good, warm, loving, conversation. It's another when we're passing groceries out through a window to somebody. They've made their selections, but instead of being able to come out and treat our pantry as though it's a real store, a grocery store, where they get to choose, we have to hand them, through the window, and that doesn't seem as dignified or as respectful. And yet, finding ways to make sure we maintain human connection with people that we serve, people in our neighborhood, has been really important. And usually when we do a lot of rental assistance, utility assistance, and people come in and sit and have a conversation, but we can't do that right now, at least not face to face. And so just thinking about what both of you said about your work, is it always, to me, comes back to how are we respecting the dignity of the people that we're serving.
Yeah, I absolutely agree. One of the things that we kept hearing over and over as we would go out and make sure the hand washing stations were sanitized, which we still practice that today, is that many people experiencing homelessness would it was the social distancing, which I don't like the term. I like physical distancing better because we're still encouraging people to remain social. But the physical distancing was compounding on the social isolation. And we kept hearing things like, man, I miss, Stacy that used to commute back and forth to work. Organizations aren't coming out and there aren't, meals aren't being shared as much. And so you could kind of feel and sense people grappling with their own self-worth. And one of the things that we we have been implementing is making sure that we still look people in their eyes, that we still call them by their names, that we still encourage them with information even, because sometimes it's hard to access technology or the information that many other people were getting from the news or their cell phones or whatever. And so, maintaining that distancing, that physical distance, but having conversations out there on the front lines. There are people who have been risking their lives on the front lines since the pandemic started. And we wanted to ensure that people who are living on the streets were seen. And I think that's what you're talking about. how do we ensure that people still feel affirmed in their dignity? And realizing that we can't give anybody dignity because it's inherent, right? It's something that we can only affirm. And we've been intentional about just calling people names, showing up, having presence, but in a safe way, and continuing to tell people and cry out and say, we see you, even when it doesn't feel like you're being seen.
Yeah, in our tradition, Episcopal tradition, we talk about in our baptismal covenant, respecting the dignity of every human being, which, as you're suggesting, is not the same as giving people dignity. It's respecting the dignity that they already have as
Right.
humans.
That's absolutely correct.
And I think the work that you three do is a constant testament to that, right? To respecting the fact that people have the right to their dignity, and it's not something that we provide them. Anterior had mentioned this briefly, and I just want to bring it up as a point. So as the beginning of the pandemic kind of starts to fade out and we get into this new chapter, there are a lot of federal aids that were put into place that are starting to be lifted. So for example, housing, people were not, landlords were not allowed to evict tenants because they could not pay, or the supplemental unemployment benefits that people were receiving are about to come to an end at the end of July. People are anticipating an estimated influx of people being evicted in various communities, and a lot of those people being people of color, Black communities, Latinx, mainly because they are a higher number of the people who rent out in these spaces. How do you think that your organizations can assist in what may come as these government aids start to fizzle out in the next coming months?
I'll start with that. St. Vincent de Paul, already we've been doing, we've worked closely with a very large Hispanic population where we're stationed in Chamblee. And during the outbreak and in the past few weeks, we've been working closely with a lot of different organizations and community groups, different neighborhoods and communities in general. We recently started working with Chamblee High School and some of those students and teachers in that space. One big thing that we've been talking about is ramping up. We just have to continue to do the work that we're doing and make sure that we continue to keep it up. And as we're working to develop our new programming, I think that will also provide resources and provide help to those in need, because now we're working on a new no to low cost pharmacy, because people will still continue to, unfortunately, people are going to be sick. And so if you don't have a job and if you have lost your job, you no longer have your benefits, this is a space that you can come to get your medication so that you can, have the things that you need. Continuing to operate in our food pantry. Our building is currently under renovation and should be done in the next few weeks, hopefully the next few weeks or so, or a month or so. And with that being said, we are expanding our pantry. And so we're just continuing to ramp up our efforts and making sure that we can do more for the communities that we serve, and continuing to serve our 72 conferences the best way that we can, and making sure that like Terrence and like Greg said, we continue to do it in a dignified manner and to respect the dignity of our clients and making sure that we're taking care of people. So that's the way in which we're handling things right now. And I'm sure it will change and I'm sure we'll get better at it. But right now we just know we just have to continue to do more and continue to ramp up our efforts.
Yeah, I would like to add to that statement. I think that was beautifully stated. We're going to continue to, remain open. Our center is here. We have showers available. We have a free laundry service that we provide for our community members. We have clothing closet. We have food. We have grooming and support services, helping individuals to continue to pursue their identification, because identification recovery is a huge part of re-entering citizenry in the United States. Because if you don't have an ID, you can't open a bank account, you can't get a job, you can't cash a check, you can't even prove that you're you, right? And so we're going to continue to do that on the front lines. But I do want to call out the fact that there are many nonprofit organizations out here that are suffering. right? And people are still showing up. Donations have declined. It was hard. I know for us, we went from, 300 or 400 volunteers every single month to volunteers being quarantined, right? And only working with a hand full of people to accomplish all of this massive work. There are many nonprofit organizations across the country and churches and programs that we're partnering with, and all of them, when we talk to them, are still, trying to lean into the courage themselves to weather through the uncertainty and the ambiguity of where we are in this context. And the last thing I would point out is that, the COVID-19 isn't over, right? Although they've stopped talking about it in the news, we all need to still, maintain those healthy procedures. Still continue. We're still going to continue to provide PPE for our community members in the face mask and gloves and sanitizer and hand washing stations. We're still going to show up, but in a healthy way, because as we are forgetting that COVID was a thing, right? By reopening, it's still a thing, and numbers continue to climb, and lives are still being lost. And frontline workers who are in our hospitals and in our healthcare facilities are on the front lines, and wherever they are still putting themselves in harm's way of possibly contracting the virus themselves in order to serve and make humanity better. And so, I just want to say to everybody who is contributing in any way, to continue to remain courageous, but also find a healthy balance of self-care, because that's a thing that we really don't talk about in terms of, people on the front lines. We also have to balance the conversation with, how are you caring for yourself? What things that are you doing, to maintain your healthiness in your mentality, right? Because we've all been affected by this in some way, and we just need to speak to that as well.
One of the things that the crisis, the pandemic, has highlighted is something that already existed in neighborhoods where we are in south side of Atlanta, southwest Atlanta, and other neighborhoods, is the threat of displacement. And so it's true that, for some people, they may have bought a little bit of time in the first month or two of the pandemic because they wouldn't be evicted or have their utilities shut off. But all this is doing is exacerbating the problem that already exists. And so we were able to, and through some generous support, get some several $100,000 that we can use for rent or mortgage or utility assistance. But we recognize that, paying somebody's rent for a month is not going to solve the long-term challenges that people face when they're financially insecure or financially vulnerable. And so I think that the real challenge for us is what happens, when that money runs out. What happens when we're not focused on helping people to stay in place anymore? We all know about the threat of gentrification, and certainly in Peoplestown, where we are, we're seeing it all over the place. I can hear out my window a construction project where about 390 new units are being built just around the corner from us. And that's going to transform the neighborhood, but it's not going to help those who are financially vulnerable, particularly those who have been here, the legacy residents. And so in some ways, I guess my point is that COVID has just amplified and made clear a challenge that already exists for people. And so the question is, how are we going to help meet that challenge beyond COVID?
Awesome. Thank you. I'm going to jump into a couple of questions that people are asking us in our panel. The first one is, these nonprofit services are essential in our current situation, but the real issues require political and social change. How do we convince politicians, church members, etc., that real change is necessary to eliminate the systems those in poverty are in need of overcoming?
Yeah, I think I love Lathoff's thought about how reframing is a part of social change, that we have to keep the narratives before people who hold public office. And those narratives have to be told, humanizing those who are affected by bad policies. What people don't talk about is that every policy that is written has a storyline. It has a hero and a villain. It has a solution and a problem. And many times, in many ways, people who are living on the margins of society are deemed problems. And that narrative communicates a message that poor people who are impoverished are to be criminalized and demonized, and we forget and forsake their individual stories, right? And that's what we're talking about, affirming the dignity of all people, or of every single person who is worthy to have their dignity affirmed. And we have to continue to press and keep their narratives and their stories before people, because they get caught up in many other different news cycles and stories. And so one of the things that we're doing is continuing to tell stories and to advocate and keep that narrative before people who are in those offices, right? One of the things that I've been recently distraught by is here, you know, underneath bridges right here in the city of Atlanta, there's somebody who's been murdering people experiencing homelessness. We lost 2 friends within the last week or so because some shooter went underneath the bridge and literally shot people while they were sleeping. We've lost about 4 people experiencing homelessness to murder because somebody decided to take their lives while they were sleeping. And so right now I'm working with people in the police department to investigate to find out who is doing this. But those stories aren't being heard, and we have to cry out and make sure those narratives stay in the forefront, because it can be swept under the rug amidst everything else.
To piggyback off of that, what Terrence said was 100% correct. We do have to give voice to the voiceless in these spaces. We do have to kind of uplift and amplify those stories, especially when we're talking about those in government and those who are creating these policies, who, like Terrence said, there is a good guy and there is a bad guy. And unfortunately, when we look at marginalized peoples, often they are dehumanized. And they are no longer seen as people. They are seen as this statistic, this thing, this other. And I think it is our job to continue to amplify and to push that these are the humanity of these people, and to showcase the humanity of these people. I think that's the only way that those in power will actually see what is going on and affect some type of change. But we have to continue to amplify. We have to continue to humanize. And again, we still have to continue to respect the dignity of these people and remember that these are people.
I think that's right on. And one of the things that I've been thinking about this week is how do I use, and we at Emmaus House use the platform that we have to, using your word, Anterior, amplify the voices of the people in our community. Mr. Brooks was murdered less than a half mile from where I'm sitting, and so in Peoplestown. And so some of us gathered on Saturday evening to talk about what we could do, community members, and to come up with a list of demands that we wanted the mayor to take seriously, and the city council to take seriously, and the police department. And so, I think I have a platform that's larger because we have, email lists and social media and everything else. And so it's my responsibility to lift up those voices that often go unheard or certainly ignored. And so I think that's a responsibility that those of us who are in organizations where we have a voice that we have. And so I sent out an email to all of our supporters yesterday with a link to that list of demands that were created by people in the community. And because I think it's important that people know that the people who in the community care about this, and that they're hurting and they're feeling pain, and that they need to be heard. And so that's a new challenge, or not a new challenge, a new something for me to dig deeper on about how I can more effectively lift up voices within the community.
Awesome. Thank you so much. As I wait for some more questions, if anyone has any questions, feel free to post them in our Q&A section at the bottom. But as we wait for more questions to come in, if you all can just share with everyone a way that they can get involved with your organizations. As we've mentioned several times with each other, the work that you're all doing is amazing, and it's really important, especially right now, in the middle of a pandemic, when people are getting sick, when people are still protesting, there are people on the front lines, there are people interacting with each other on a daily basis, and there's so much importance in the work that you all are doing. How can our participants get involved with the work that you do?
Yeah, I'll jump in really quick because it's fresh on my heart. We've been doing work on the Navajo Nation reservation out west, and cases continue to rise on this reservation. Out there is no running water, and so our portable sinks, in partnership with some leaders at the various houses, these leaders have been transporting gallons and gallons of water from miles and miles on end to ensure that people on the reservation who are indigenous have access to running water. And so we're going to continue to ramp up our efforts to provide these hand washing stations. So when people go to grocery stores and they go to some spaces on the reservation, they'll have access to hand washing, which is one of the most important ways for people to protect themselves. And if you would like to get involved and donate, you can literally go to lovebeyondwalls.org and click Love Sinks In. We're going to continue to ramp up our efforts and ensure that many cities across this country has access. And this is not something that we're doing on our own. We are highly collaborative. We are actually working with individuals who are proximate to communities living on the margins, because we understand that this takes a unified effort, that no one organization can do this work alone, but we are working alongside individuals who are in this work every single day. And so if you want to support, again, the campaign that we're doing is called Love Sinks In.
Terrence, I love the word you just used, and it makes me think of Brian Stevenson, because he talks about this, that one of the most important things that we can do is get proximate with people who are suffering. And so finding ways to engage that are respectful and appropriate is one of the best ways for us to change people's lives and their hearts. And so creating volunteer opportunities that, again, are appropriate is a little challenging during this crisis, but certainly something that we want to work on as the pandemic hopefully winds down, so that people can engage and be part of solutions. And like I said, that's not always easy, but I think it's something that's important.
That's a great point, Greg. For us, we still have our opportunities within our food bank. And if you'd like to assist in helping us hand out food to families or deliver, we still have that opportunity going on as we develop our workforce programming and our pharmacy, and we kind of set things up. There will be opportunities available. If you have questions, my email is in the little box there. But as we continue on, we have all of these new programs that we're developing and that we're working on that will be up in September. And with those programs, we'll be creating those opportunities for people to assist, because like most nonprofits, we run through volunteerism, and volunteerism is how we make the things happen. And so we love to have volunteers in the space. We love to create opportunities for volunteers. And it is difficult sometimes, especially with COVID, trying to figure out the best way to make sure that we're keeping everybody safe. But we still want to go ahead and make sure that we're giving all we can to our clients, and creating those opportunities for community members to assist the best way they can, and to share their talents with us. So if you have any questions, I am certainly here at our website. website, svdpgeorgia, georgiaspelled.org. There's a tab about getting involved, and all of the opportunities that we have are there. And if you have any questions for me, I'm totally down to answer any of them.
Thank you. We do have a couple of questions that came in. One that we have is that there are other states that are utilizing hotels and motels for shelter in place. Do we know of this happening in Georgia? Do we think that that's possible in Georgia? Would your organizations be interested in trying to make that happen here?
Yeah, well, I can't speak to surrounding cities all throughout Georgia, but I know early on in COVID, the city of Atlanta was gifted a hotel, and that hotel has been used for isolation for individuals who have contracted COVID-19 and have tested positive. And I'm still sure that this space is being used in the proper way. As far as hotels across the country, I know the state of California and some of the Midwest states acted really fast in leveraging hotels to house people. But my concern is, as the country starts to reopen, hotels are probably going to pivot back to business as usual. And I think one of the things that politicians need to start thinking about is, I saw somebody make the comment of, abandoned buildings. Like, how do we think about repurposing spaces that are already available and retrofitting them to service a population of people that are forgotten? I definitely believe that, the housing first model has been very beneficial to individuals out on the West Coast. I would like to see that adopted more on the East Coast, where people are having access to housing at a faster pace before like trying to get a person in a, to where you want them to be, but just like giving them a platform to lunch from, and then wrapping community support and services around them, and then walking with them, not walking for them, but walking with them and affirming their dignity as a journey towards self-sufficiency. And there are many articles that show that escaping poverty within itself is a task. Like, there are studies that show that if you don't have social connections and social equity, that it could take 20 years to escape poverty without anything going wrong, right? And so we really need to consider the courage it takes to survive poverty and the experience of homelessness in this country. And also, like to your point earlier, we do need to hold our politicians accountable and raise these concerns and continue to put these narratives before people who can actually make these decisions. But yes, I'm definitely open to helping anybody think about how we can innovatively address that issue.
Thank you. All right. I have another question. This one is for Anterior. How are you engaging high school students in your work? I'm a high school teacher and would like to activate my students in service projects this fall. And without knowing what the CDC regulations will be or how we are returning, I was wondering what it looks like now.
Good question. So right now we have been talking closely or speaking with teachers from Chamblee High School specifically. The way in which we've been kind of working to get students into the space right now is because we have this, especially this drive-through model where we're outside and we can have larger groups of students to help assist kind of package food, get things put into people's cars, and kind of do it in a manner in which they're not really, they're not on top of each other. They're not so much dealing with or kind of touching anybody else. We're doing it in that manner. So what I've been working with as far as high school groups and other kind of community service-based groups who want to help is contact me, and we can kind of figure out what your group looks like, what you guys want to accomplish, and then working a way to figure out how we can get you into the space and do it in a way that we can stay within CDC guidelines. And as we start to develop programming and start doing more things, when we open up our bigger space, the hope is that we have more opportunities for students to come in, specifically because I love youth volunteers. They are by far my favorite. I love adults too, but I really love youth. I love young people wanting to assist. I think it's amazing. So yes, contact me, please. And we can definitely find a way for your students to assist, because at this point, our numbers are continuing to rise. We still have clients who are wanting food and who need food, and we're doing all that we can. So as many volunteers as we can have in a space that's safe, we're open for it.
Awesome, thank you. Another question, what is one change of mindset or terminology you would all recommend for everyone on the call to do to preserve and promote dignity of the disadvantaged and marginalized?
One of the things that I learned a while ago was when we talk about people living in poverty, is I kind of tried to change my language to talk about specifically about financial poverty or being financially vulnerable. You know, to say somebody lives with poverty suggests that their whole life is about poverty. And what I found is that a lot of the people that I've gotten to know have, you know, there's an amazing richness and tapestry to their lives. And financial poverty is tragic and shouldn't be in our country, but it's only one part of what comprises a human being or a family. And so to try to be careful about the way I describe people, so that I'm not suggesting that that's the sum total of who they are as people.
Yeah, I try to change the rhetoric around, you know, you have a lot of people that say homeless people. I use experiencing homelessness or experiencing poverty because it is an experience, it's not a person. And we have to push back against the labeling, right? Because if I didn't have a truck, you wouldn't call me truckless, right? It's just, you know, I don't have a truck at the moment. And I think we need to use this reframing to help deconstruct the biased narratives that we hold about people who are impoverished across the country, right? And it goes back to narrative. What's the dominant narrative that you hold that persists when you see people experiencing poverty or homelessness? And in most cases, it's that, you know, people experiencing homelessness or experiencing poverty are lazy or have a character flaw or some type of moral issue or they're criminal, right? And all of these narratives are associated with the definitions or the frames that the conceptual frames that we built up. And we need to challenge those with reframing. Like, you know, a shift in words can bring about so many different thoughts. The other thing too is I like to encourage people is to challenge your own thinking, right? You know, go through the 7 whys. Ask yourself, why do you believe this? And then after you answer, ask yourself, why do you believe that? And just continue to go through to help you find better language and better logic as to why you believe something about someone. And if it's from secondhand information, that's the problem, you know, and that's what we're trying to change. You know, it's better to be proximate, as my brother Greg described earlier, and to really understand the context of someone's story and their journey so you can affirm their dignity, than to hate someone at a distance. And that's what we got to get away from.
A term that was brought up in this conversation, Terrence said it was physical distance. And I thought that was a great way to talk about what it is that we're doing during this time. Because socially, we all still need to interact. That's a part of kind of what makes us human. Distancing ourselves socially can cause a lot of things mentally and can put us in a negative space. So I love the term physical distancing because that's what we're doing. If we get to the point where socially we're not connecting, we're not, you know, interacting with each other, that creates a whole other set of problems. So we don't want those problems, and we already have enough problems as is. So I think that physical distancing idea is the best way to say that. Also, we do need to educate ourselves. We need to do the research. We need to kind of figure out, like Terrence said, why do we believe the things that we believe? Who gave us this information? Did we seek this information ourselves, or did somebody else give us this? And also, with that, we need to look at our own information instead of just someone told me that this is how this works, so this is how it is, and that's not always the case. So we should always seek to understand, and I think that's something that we have to do, especially when we're talking about those who are experiencing homelessness, instead of having our own mind and thinking that, or using someone else's language to talk about how we feel about these things. Really think about it and really understand what it is. And yeah, that's what I have to say in regards to that.
Awesome. Thank you. This is our final question, and then we're going to wrap it up. I would like to thank you all for being here. This has been amazing. Final question is, you all work in slightly different areas to support those experiencing chronic hardship. Is there one specific group or issue you believe we as a city or state cannot ignore right now?
Well, I mean, for me, I love ML King's language around the triple evils: poverty, racial injustice, and militarism. This attitude of violence towards individuals. And so, because I do anti-poverty work and narrative justice work, I would like to see the language change around what it means to experience poverty in this state and in this country. This is a conversation that we have to keep at the forefront. Just like, in any political debates or any political campaigns, as people run on specific agendas, right, and are trying to get these agendas to be adopted by the public, there should be issues like poverty and the experience of homelessness in these conversations. It shouldn't be like highlighted with a marker and then move to a footnote. It should be in the center of the conversation that in all cases, in all ways, because specifically speaking to Atlanta, it's one of the cities that has the highest economic disadvantages of people living on the margins. The economic gap between rich and poor here in the city is one of the highest in the nation, and is definitely something that we need to address across this state, but nationally as well.
I guess it would be stating the obvious to say that in this, excuse me, in this moment, the conversation about reimagining policing is essential, and we can't miss the opportunity to hold that up, and that's going to take a lot of hard work and a lot of will to make that happen. And then other issues besides that I think Terrence, the income inequality that's just getting worse and worse is not going to go away unless we do something about it. And that really means lifting up those at the bottom of the economic, the bottom level, and finding ways to lift people up, to lift people out of financial poverty, to create meaningful living wage job opportunities, to create the right kind of educational opportunities for children and youth so that they can be prepared for 21st century workplace. So we have a lot of challenges ahead of us.
I agree with both of those points, gentlemen. For me, I would say education and the way in which we educate is really, really important, and especially understanding the history of the country in which we live. I think once we really break down and really understand our history fully, I think we can start getting into that reform with policing and really talking about those inequalities of different communities, marginalized and not marginalized. So education, I think, is a big starting point with how we change the dynamics of how we live and the way in which we live in our society.
Awesome. Again, thank you all so much for being here with us today. Before I jump into announcements for upcoming programs on the behalf of the National Center for Civil and Human Rights. Again, our donors, our sponsors, our CEO, our volunteers, our staff. Thank you so much for being with us today. Greg, Terrence, Anterior, it was a pleasure. Thank you so much.
And thank you for having us.
Of course, thank you for coming. And for our participants, again, please get involved in our campaign for equal dignity. You can sign our pledge at equaldignity.org. We are continually doing work to have these discussions and also put out new materials. Coming up, we have a few great opportunities. As Greg was mentioning with policing, we have a program next week on what does defund the police actually mean. That's going to be on June 26th at 12 p.m. Please join us. The links will go out. Again, if you sign our pledge, we'll give you all that information. Also on July 19th at 5 p.m., we have equitable dinners, Lift Every Voice. We'd love to see you there as well. And then finally, if you'd like to learn more about our upcoming conversation with Dr. Dennis Mukwege, just follow us at the Center powertoinspire.org. Again, we'd like to thank you so much for being here with us today. Thank you so much to our panelists. We really appreciate it, and we hope you get out and get involved with this group of people that are doing amazing work. Thank you so much.